Kiambu health crisis, a collapsing system, abandoned patients, and a governor at war with doctors. Kiambu County, once known for its proximity to the capital city and historically reliable access to public services, is now engulfed in humanitarian emergency within its health care system. What is unfolding is not a temporary disruption or administrative hiccup. It is a systematic collapse driven by negligence, arrogance, and the remarkable failure of leadership under the governor, Wamatangi. For months, the country's health infrastructure has been paralyzed by persistent doctor strikes. Instead of pursuing dialogue with health professionals, the governor has adopted an openly confrontational stance marked by threats, intimidation, and public posturing. Efforts at negotiating have been rejected. Unions' concerns have been brushed aside. Specialists raising alarm have been met with hostility rather than engagement. As a result, the public health system is now teetering on the edge of total failure. The consequences of this standoff are unprecedented in the era of devolution. In response to the county's continued hostility and leadership paralysis, the national government withdrew 697 medical intern doctors who had been posted to various facilities within Kiambu County. The withdrawal alone would have been devastating, but the situation worsened when the fresh cohort of medical interns expected to reinforce county hospitals were deliberately reassigned to other regions, bypassing Kiambu completely due to its toxic working environment and deteriorating relations with the county authorities. Those who remain in the system, nurses, clinic officers, specialists, and support staff, are either on strike or trapped in intolerable conditions with no meaningful support from the county government. The message has been painfully clear. Kiambu is either incapable or unwilling to manage its health functions. At the heart of this collapse are the county's largest referral facilities, Kiambu Level 5 Hospital and Thika Level 5 Hospital. These centers, which should be serving thousands of patients each day, have been reduced to shells of inactivity and despair. Wards are deserted and completely unmanned. Patients wait in long queues only to discover that no medical personnel are available to attend to them. Operating theaters are silent, pharmacies are unstocked, maternity units are overwhelmed, and essential equipment gathers dust as emergencies go unanswered. It has become tragically common to see relatives shuttle their loved ones from one hospital to the next in search of help that never comes. Many, driven by desperation, have resorted to hiring private ambulances in Nairobi, Machakos, and Murang'a counties. What began as a crisis has now hardened into a catastrophe. Behind the muted public statements and political posturing are gleam statistics that reveal the true scale of the disaster. From the media today, you could read that at least 136 infants have died in neonatal and pediatric wards due to the absence of personnel to administer care. No fewer than 20 mothers have lost their lives during childbirth or for preventable post-delivery complications, cases that not have been turned fatal if basic medical supervision had been available. Emergency referrals to neighboring counties have become journey of last resort, with some patients collapsing and dying on the way. These are not acts of fate, but the direct outcomes of leadership that chose coercion over conversation. Families are mourning loved ones not because diseases are unstoppable, but because governance failed when it was needed most. Kiambu County is home to over 2.5 million residents who depend on public health care services. Here today, access to medical care is uncertain, dangerous, and in some places non-existent. When a devolved function becomes a threat to human life, the nation cannot look away. For the sake of those who live and suffer in Kiambu, there must be an immediate and decisive intervention. The only realistic life-saving path for it is for the national government to assume control of health function in Kiambu County moving to 2027. This is not a political maneuver, it is an act of rescue. The Constitution makes provisions for national intervention when a county fails in its basic obligation to protect its people. Kiambu has not only demonstrated immense incompetence, but has shown no willingness to resolve the ongoing stalemate. Devolution was not designed to shield impunity or justify the abandonment of citizens. The Kiambu governor, Wamatangi, has created a vacuum where leadership should exist. Dialogue has been replaced by dictates, cooperation has substituted with coercion, and humility eclipsed by intransigence. The withdrawal of interns, the collapse of key facilities, and the mounting death toll are fruits of stubbornness rather than resource scarcity. This is not a failure born of poverty, it is a failure born of pride. Healthcare is not a campaign slogan, it's a constitutional right, a moral obligation, and a lifeline. In Kiambu, that lifeline has been severed. Every additional day that this crisis continues brings more grief, more preventable deaths, and more irreversible loss. Infants will continue to die before they take their first breath. Mothers will continue to continue entering labor wards with hope and living in caskets. Patients will continue collapsing on cold benches while waiting for doctors who will never come. The suffering has already gone on far too long. If the county government cannot protect its people, then we urge the national government to come in and intervene. Not tomorrow, not next week, but immediately. Anything less amounts to complicity in the continued loss of innocent lives. So that is our message, signed by members of parliament from Kiambu County. My colleagues here will add either in English or in our local language. And after that, if you have any questions, we'll be able to answer the questions. Welcome, Mheshimiwa Alice.
Honorable Kahangala has put it the way it's supposed to be, but to add, the 136 infants are from Kiambu Level 5 and Thika Level 5. Those are only 2 constituencies in Kiambu County where we have 12 constituencies. We are not talking about the other 10 constituencies. It means the number will be higher. If we add the other hospitals, the number will go higher. It means the blood of our children and those of our mothers, it is on the hands of Governor Wamatangi. This is pure massacre, where children are dying and the county government is doing nothing about it. If you go to those hospitals, even if you visit the 4th estate, you visit those hospitals right now, they are in a pathetic state. Actually, the hospitals of Kiambu County are in ICU, all of them. The hospitals themselves are sick. There are no medicine, there are no doctors, the cleaners are not there, the facilities are in a mess. Not only even in the hospitals, even if you go to the morgues, the stench is coming from far and wide. The estates next to those morgues, we are talking about the health sector in Kiambu County has truly failed. And we saw the other day in Gatundu North, where a father was taking the child to the hospital. And when he arrived at the hospital in Gatundu North, there was there was even nobody to receive the father and the child. So the child died when the father was holding the child in his arm, and he was trying to call, who will receive my child? There was nobody. If you go to Kiambu hospitals, and they are national hospitals, they are referral hospitals, they close at night. Have you ever had hospitals that they close at night? And I can see the mothers from the 4th estates, where if you know, for some reason, children always become sick at night. So if these hospitals are not operational at night, then who are they serving? And to be very honest, the interns who have been retrieved back to the national government, the interns come to be attached to the doctors, and the doctors are not operating. So what, in fact, those 3 months, what were those interns doing in Kiambu County? Because if at all you're supposed to be attached to a doctor so that you can see how medication or how treatment is offered, and there are no doctors, there was no even need for those interns to be in Kiambu County in the first place. The doctors have tried to talk to the county government, to no response. What the governor does is PR. He doesn't want to meet the doctors and raise the issues that have been raised today here by the members of parliament. What we are telling you, the members of 4th estate, just visit Kiambu County. Whichever hospital you pick at a random, those hospitals are dead. If not ICU, the facilities are dead. And that's why you can see in 2 hospitals, only referral hospitals, Kiambu and in Thika, 136 infants are dead. If you add the other constituencies, the number even will reach 500, meaning there are so many people who are mourning in our county because of negligence of the county government. So many people mourning. If you go to KU referral, or if you go to Kenyatta National Hospital, or Murang'a hospitals, the Kiambu people have opted to go to those counties for health care. And if you realize, years earlier, people would move from other counties, even northeasterns, or even Machakos and Murang'a to come to be treated in Kiambu County. This time, vice versa. Wamatangi has really killed our health facilities in Kiambu County. He's murdering our children, and we are watching, and we have said enough is enough. As members of parliament, we will not sit back and watch Wamatangi wasting our health facilities. Thank you very much. Pale Kiambu County, mahospitali ya Kiambu County iko kwa state ya ICU. Tumeona watoto wetu wa Thika level 5 na Kiambu level 5, watoto wale wamepoteza maisha yao ni watoto 136. Na tunataka kusema hizo ni hospitali mbili tu Kiambu County. Kiambu County tuko na constituency 12. Na tunataka kusema hata wamama, juzi tumeona huko Igegania, baba amepeleka mtoto hospitali na amemshika hivyo, na anajaribu kuitana afunguliwe kwa mlango kwa sababu mtoto wake alikuwa kwa critical condition. Hakuna mtu aliwa-receive. Kwa hivyo huyo mtoto aliaga akiwa mkononi mwa baba yake. Tuko hapa kusema ya kwamba hospitali za Kiambu County zimeisha na zimekufa. Akiwa ziko ICU ni gonjwa kabisa. Ukiona hata mkitembea siku ya leo kule Kiambu County, mtaona ya kwamba hakuna madawa, kujaoshwa, hakuna patients, kwa sababu patients wa Kiambu wamejua ya kwamba hakuna madaktari. It has taken 127 days tangu madaktari waende on strike. County government hata reach out. Tumeona juzi the interns wamerudishwa kwa national government kwa sababu interns walikuwa wanakuja Kiambu County ndio wapatiwe madaktari wafundishe waone vile madaktari wao wanatibu wagonjwa. Lakini kwa sababu hakukuwa na madaktari au interns wote wamerudishwa kwa national government. Tungetaka kusema ya kwamba hii maneno imeendelea for quite some times na governor hataki kusikiza. Hiyo damu yote iko mikononi mwake ya hao watoto na hao wazazi, kwa sababu yeye ndio amekataa kusikiza madaktari, yeye ndio amekataa kutafuta suluhu kwa hii jambo ama janga la mahospitali ya huko kwetu Kiambu County. Tunataka kusema kama wajumbe hapa, hatutanyamaza tena. Akiwa hiyo function ya health Kiambu government wameshindwa, wairudishie national government ndio kusiendelee, watu wetu wasiendelee kukufa na kuaga kwa sababu ya kukosa madaktari na madawa kule hospitalini. Hata ukienda not only the health facilities themselves, hata ukienda zile mortuaries ambao zinakaribia hizo mahospitali, mnuko unasikia ukiwa kwa umbali, kuna nuka vibaya sana. Na ndio nataka kusema siku ya leo tukiendelea hivi, na unajua population ya Kiambu is very high. Ukienda KU referral ama uende Kenyatta, watu wote wa Kiambu wamehamia referral, na wengine Kenyatta na wengine Murang'a. Na zamani tulikuwa tunajua ya kwamba Kiambu County ilikuwa ina serve Machakos pamoja na Northeastern pamoja na Murang'a na pamoja na Nairobi, lakini as we speak today hakuna facility hata moja inafanya kazi huko kwetu Kiambu County. Asanteni.